What if I told you that a simple plant could change the way we think about medicine? Could it really be the solution we've been waiting for? Medical marijuana, once a controversial topic, now becoming an essential part of the conversation around health and wellness. But does it really work? Is it safe? And why are so many people turning to it for treatment? In today's video, we're diving deep into the world of medical marijuana, busting myths, revealing facts, and answering the questions everyone's asking. But it's not just about pain management. Could medical marijuana be the key to treating anxiety, insomnia, or even PTSD? I've spoken to patients who say medical marijuana has literally changed their lives. But is it as simple as lighting up a joint? Before you rush to try it, let's break down the science, the legalities, and what you should really expect from medical marijuana. Understanding the difference between THC and CBD is crucial. These compounds can have completely different effects on the body, and it's important to know what's right for you. I've got all the details, and I'm here to answer your questions about how medical marijuana could be a game changer for your health. Stay tuned, because by the end of this video, you'll have a clear understanding of how medical marijuana works, what you need to know before using it, and if it's the right treatment for your condition. And don't forget to hit that subscribe button and ring the bell so you never miss out on the latest information in the world of medical marijuana. Let's dive in. In this chapter, we'll explore the various uses of medical marijuana and the mechanisms behind how it works. Medical marijuana is used to treat a variety of conditions, including chronic pain, anxiety, and epilepsy. But how exactly does it work? The active compounds in marijuana, THC and CBD, interact with the body's endocannabinoid system to produce therapeutic effects. THC binds to CB1 receptors in the brain, which can help reduce pain and stimulate appetite. CBD, on the other hand, interacts with CB2 receptors in the immune system, which can help reduce inflammation and anxiety. By understanding these mechanisms, we can better appreciate how medical marijuana can be used as a treatment option. Imagine the relief for someone who has been suffering from chronic pain for years, finding a natural remedy that finally works. Or think about the peace of mind for someone with anxiety, discovering a way to calm their mind without the severe side effects of traditional medications. The science behind medical marijuana is fascinating and offers hope to many. Cannabis is a plant-based or botanical product with origins tracing back to the ancient world. Evidence suggests its use more than 5,000 years ago in what is now Romania. There is only one direct source of evidence that cannabis was first used medicinally around 400 AD. In the US, cannabis was widely utilized as a patent medicine during the 19th and early 20th centuries, described in the United States Pharmacopoeia for the first time in 1850. Federal restriction of cannabis use and sale first occurred in 1937 with the passage of the Marijuana Tax Act. According to Harvard Health Blog published April 10, 2020, the least controversial aspect of medical marijuana is the extract from the hemp plant known as CBD, which stands for cannabidiol. This component of marijuana has little, if any, intoxicating properties. Marijuana itself has more than 100 active components. THC, which stands for tetrahydrocannabinol, is the chemical that causes the high that goes along with marijuana consumption. CBD-dominant strains have little or no THC, so patients report very little, if any, alteration in consciousness. Patients do, however, report many benefits of CBD, from relieving insomnia, anxiety, spasticity, and pain, to treating potentially life-threatening conditions such as epilepsy. One particular form of childhood epilepsy, called Dravet syndrome, is almost impossible to control, but responds dramatically to a CBD-dominant strain of marijuana called Charlotte's Web. The most common use for medical marijuana in the United States is for pain control. While marijuana isn't strong enough for severe pain, such as post-surgical pain or a broken bone, it is quite effective for the chronic pain that plagues millions of Americans, especially as they age. Part of its allure is that it is clearly safer than opiates. It is impossible to overdose on and far less addictive, and it can take the place of NSAIDs such as Advil or Aleve if people can't take them due to problems with their kidneys, ulcers, or gastrointestinal reflux disease. According to the CDC, the Food and Drug Administration (FDA) has approved one plant-based cannabis drug called Epidiolex, which contains a purified form of CBD. The prescription medication is approved for treating seizures associated with two rare and severe forms of epilepsy, Lennox-Gastaut syndrome and Dravet syndrome, as well as seizures associated with a rare genetic disorder called tuberous sclerosis complex. The FDA has also approved 2 medicines, dronabinol, brand names Marinol and Syndros, and nabilone, brand name Sesamet, that are made from a synthetic or lab-made chemical that mimics THC. These medicines are used to treat nausea in patients with cancer who are receiving chemotherapy treatment, and also to increase appetite in individuals with AIDS who have a poor appetite eating, wasting syndrome. These approved products are only available with a prescription from a licensed healthcare provider. There are currently no other FDA-approved uses for cannabis or its derivatives. Stay tuned for more insights as we delve deeper into how this plant can make a difference in people's lives. Remember, knowledge is power, and understanding how medical marijuana works can help you make informed decisions about your health. Let's continue this journey together.